The Deputy Minister of Health Transformation, the Health Minister, the Clinical Chief of Cardiac Care, and a VP of Health Services Transformation, all gathered at the Confederation Building to talk about heart and stroke care.
These things are really important, right? I've been at this a long time, and this is transformative. I've never felt this kind of input, focus, and progress.
They talked about how virtual care is improving treatment for heart failure patients. They spoke about the transportation service called Heart Force One that's helping heart patients get treatments more quickly. In the past year, it's made 16 flights carrying 118 patients. And they outlined how access to surgery and drugs for strokes has improved. 20% of stroke patients who need clot-busting drugs are getting them. It used to be 10%.
So to summarize, treatment is now being used in the province. It is leading to better outcomes for heart and stroke patients. They are getting the crucial care that they need sooner, and we are expanding on the use of these treatments to reach even more patients.
This was a well-scripted, prepared distraction. And for me, I can't accept it. I'm the health critic for my caucus, for my party. And I think the minister should be called out on it.
But Evans says the government is using this event to try to turn the public's attention away from the tens of millions of dollars they're spending on travel nurses.
They tried to find a good news story to put forward as smoke and mirrors to detract from really the scathing report that came out in Globe and Mail.
Again, Osborne said travel nurses were a necessary evil, and their high cost was crucial to keeping health services available.
You know, if you were to go back in time to when the health authorities made the decision to contract the agencies, you would probably have undoubtedly have made the same decision. The alternative would have been more procedures cancelled, more services not available, more emergency departments closed.
Evans says paying travel nurses was a quick fix when the money should have been spent long ago on improving the working conditions of nurses and preventing the nursing shortage that we have.
Why do we have nursing shortages? Because our poor old nurses are burnt out, they have no quality of life, the mental stress, the physical stress, and also the stress from their families because they don't have quality of life. That wasn't addressed.
Osborne said the government is working hard to fill the more than 700 nurse vacancies in Newfoundland and Labrador. He expects the province's reliance on travel nurses will be greatly reduced in the future. Mark Quinn, CBC News, St. John's.